How to use health coverage comparison sites properly. Beginner mistakes that cost you. Health coverage comparison sites can be a lifesaver, but most beginners get it wrong and end up choosing a plan that doesn't truly meet their needs. The surprising truth is that even small mistakes here can cost thousands in medical bills. The first mistake is focusing only on the monthly premium. While a low premium looks attractive, it often comes with high deductibles, co-pays, or limited coverage. Always evaluate total costs, including out-of-pocket expenses and potential annual maximums. Another common error is ignoring provider networks. Make sure your preferred doctors, hospitals, and specialists are in network. Out-of-network visits can be extremely expensive, and some plans may restrict coverage entirely outside the network. Many users also overlook prescription coverage. If you rely on ongoing medications, check that the plan covers your prescriptions and at what cost. Some plans may exclude certain drugs or place them in high-cost tiers. A surprising mistake is not considering emergency or out-of-state coverage. If you travel frequently, verify that the plan covers urgent care outside your home state. Some plans may require pre-authorization, which can delay treatment. Finally, beginners often ignore additional benefits. Comparison sites often highlight perks like telehealth, wellness programs, or mental health support. Using these benefits can save money and improve access to care. To properly use health coverage comparison sites, focus on total costs, verify provider networks, review prescription coverage, check emergency and out-of-state rules, and leverage extra benefits. Avoiding these mistakes ensures you pick a plan that genuinely protects your health without breaking the bank.